The next bill on the calendar for the day is Senate File 1425. The clerk will report the bill.
Senate File number 1425, number 7 on the calendar for the day, an act relating to health, the first engrossment.
Recognize the member from Chisago, Representative Barrett, to introduce the bill.
Thank you, Mr. Speaker and members. Senate File 1425 relates to the issue of prescription drugs and the ability for end users to deliver their unused, unwanted prescription drugs to a pharmacy for proper disposal so they can stay out of the hands of those who would use them illegally. Mr. Speaker, I also have an amendment.
There is an amendment at the desk. The clerk will report the amendment.
Barrett moves to amend Senate File 1425, the first engrossment, and the amendment is coded A16-1190.
I recognize the amendment author, the member from Chisago, Representative Barrett, to introduce the amendment.
Thank you, Mr. Speaker and members. The particular amendment we have here relates to Narcan, naloxone, and the ability for pharmacies to be able to prescribe that to more people more often in a way that they can't currently do now. Let me back up and say that the issue of opioid abuse, drug abuse in our country is a crisis that is a result of thousands and thousands of family tragedies across our country. In 2014, 48,000 people died of a drug overdose. In 2015, more than 570 people died of a drug overdose in the state of Minnesota. That is an increase from 2014. We have a huge crisis in our country. Naloxone is an antidote for opioids. Opioids are being abused at record rates. This particular amendment to the bill allows for pharmacies to develop a protocol with doctors based on a Board of Pharmacy approved protocol that is administered with help from the Department of Health. The amendment has been worked on with, it's a bipartisan amendment, including Representative Kim Norton, the Board of Pharmacy, the Department of Health, and others. I would appreciate your support on the amendment.
The member from Washington, Representative Schoen.
Thank you, Mr. Speaker. I just want to rise in support of the amendment and to remind anyone that when you go to the pharmacy today, you can get a flu shot from a pharmacist, which is much more invasive. They can give you vaccines. This here is about saving lives with a drug that is for one purpose and one purpose only, and that is to keep families together. Thank you, Representative Barrett. This is the right direction to go. This is very, very safe drug to be handed out to folks, and it's very easy to use and very easy to explain and teach people how to use to save their loved ones and friends. Thank you very much.
The member from Olmsted, Representative Norton.
Thank you, Mr. Speaker, and I too rise in support of this amendment. It's been a pleasure to work with Representative Barrett to try to find some language that both the Board of Pharmacy and the MMA and the public health folks all agreed on. We have done that. I made an attempt last week and we weren't quite there, so I really appreciate the stick-to-itiveness with Representative Barrett to get this done this year. I also want to just remind folks, if you haven't had a chance to get to your emails today, I did forward all of you the Minnesota Department of Health report on drug overdose from 2000 to 2015. It's very eye-opening, and it shows that this is not a metro problem. This is a Minnesota problem. It's probably a national problem. But the results of this survey should be very helpful in allowing you to support the amendment and the entire bill today. Thank you.
Further discussion on the amendment? Seeing no further discussion, all those in favor of adoption of the amendment A16 signify by saying aye. Aye. Those opposed, no. The motion prevails and the amendment is adopted. There are no further amendments at the desk. The clerk will give the bill its third reading.
Third reading, Senate File number 1425, as amended.
Third reading. Discussion on Senate File 1425 as amended. The representative from Hennepin, Representative Hillstrom.
Thank you, Mr. Speaker. And I didn't rise to ask this question during the amendment because I'm fine with the amendment being adopted. But the question that I have for Representative Barrett is if you're going to have the pharmacy dispensing naloxone, under Minnesota laws, drug laws, it is illegal or a crime to possess this drug without a prescription. So do you believe that you have addressed the issue with the pharmacy dispensing this, that you've taken care of the without a prescription possession? So folks who are carrying naloxone are not going to be charged with a fifth-degree controlled substance crime.
He will yield. Representative Barrett.
Thank you, Mr. Speaker and members. That's a great question. The truth is, pharmacies right now can enter into a drug protocol with doctors. They do that currently. The unfortunate part of that is, especially in rural areas, there's not always a doctor available to develop a protocol for that pharmacy. You would think they would, but in practice it just doesn't happen as often as it should. In addition, even in the metro area, pharmacies are having trouble finding a doctor to develop or create a protocol, an agreement to dispense naloxone. So this allows for a wider expanse of options for that pharmacy to be able to develop a protocol through the Board of Pharmacy and through the Department of Health. So it increases the, hate to use the word inventory of doctors who would be available to provide a protocol for that pharmacy who wants to dispense naloxone.
Representative Hillstrom.
Thank you, Mr. Speaker. And Representative Barrett, I understand that you have made it so that the pharmacy and the doctor won't be in trouble. My question is, once the person actually has naloxone in their possession, will this be considered the same as a prescription so that they will have the ability to not be charged with the controlled substance crime of possession of naloxone?
He will yield. Representative Barrett.
Mr. Speaker, members, yes.
Any further discussion? Representative Barrett.
Thank you, Mr. Speaker and members. And again, I want to thank everyone who's been involved in this, especially Representative Norton. I also want to thank someone who generally doesn't get thanks, Dr. Cody Weiberg at the Board of Pharmacy. That guy is a saint. He works behind the scenes to do many things to improve the health of the people of Minnesota. Doesn't get a lot of credit, but it certainly deserves it. It's a very important issue. This is one step in a multi-step process to try to relieve Minnesota of the crisis and actually reduce the amount of pain and suffering and death that families are going through in our state. So thank you very much. I would appreciate your support.
Seeing no further discussion, the clerk will take the roll on the bill. The clerk will close the roll. Keel votes aye. There being 130 ayes and 0 nays, the bill is passed as amended and its title agreed to.